Hello, I'm Dr. Andrew Wilner, and today I'd like to talk to you about multiple sclerosis. I just got back from the annual international meeting of multiple sclerosis, which was held in Barcelona, Spain. And it was a very inspiring meeting because it turns out there's enormous progress in the research and treatment of multiple sclerosis. When I was in training as a resident, we had no treatments whatsoever. In 1993, there was the first treatment, which was an injection, and today many patients are taking an injection usually every day or every other day. Some of the good news about advances is one of the common drugs, Copaxone, which has to be taken every day, is now available in an every other day. So instead of an injection every day, it can be an injection every other day. So if you're taking the everyday one, talk to your doctor and ask, can I do it every other day? So have the injections and half of the injection site reactions. There's another drug, Avonex, usually once a week, now once every 2 weeks. So again, the possibility of decreasing the frequency of injections. If either of these drugs are not working for you, there are now 3 oral medications. This is brand new, just in the past few years. Now you can take a pill for the treatment of multiple sclerosis, a daily oral medication. And these medications seem to be at least as good as the injections. However, because they may be a little more powerful, there is also an increased risk of side effects, and they require very close follow-up. They require 100% adherence to therapy and regular doctor visits to monitor for possible side effects. The other news is that there are drugs that are given by vein in an infusion. There's a new drug that's been approved called Alemtuzumab, which is a monoclonal antibody, very, very fancy. It also has very serious side effects, but it appears that it can be very useful for people with severe aggressive disease. There's another drug, Natalizumab or Tisabri, available again by infusion once a month. What was particularly exciting at the meeting, there's a new drug that is not yet FDA approved called Ocrelizumab, another monoclonal antibody. And it looks like this may be the first drug that will be useful for progressive MS. Most people with MS, it's called relapsing remitting MS, but about 15% of people with multiple sclerosis have what's called progressive MS, and we have no treatment for that. Ocrelizumab in the phase 3 trials was positive. It worked. It's not yet approved by the FDA, but next year the FDA will consider it, and if it is approved, it will become available for treatment. So overall, this year there's enormous good news for people with multiple sclerosis. So discuss these options with your doctor.